The healing touch. Touch. It's interesting because my friend says she still does a physical exam because patients expect it. She's an oncologist. The main exam they do is called the CT scan because you can't feel most cancers inside of you. In terms of touching people, it's very interesting because I understand it's important, but I think it's also important for a different generation. Like if you're a 30-year-old, 20-year-old, you could care less. Maybe. I don't know. I'm not 30 or 20 anymore. But I know for people older, they do find the touch still important. Like I had one lady who I examined, and I forgot her shoulder because she was saying it's pain for her back or something like that. And she made a comment that I found really interesting. Because I asked her before whether she had a good relationship with her primary care doctor. Because I find that important because then I could refer them back. Because a lot of things you have to work over in time. And she said yes. But then she says her doctor doesn't touch her. How do you tell about somebody's back pain without feeling their back? I mean, you could order CT scans and x-rays and all that stuff. But you gotta see, you can't feel muscle spasms. I do physical exam stuff when it's necessary. Many times I don't. I skip it because it doesn't really add anything, right? But if you translate it more figuratively, the healing touch is not literally touching, but the healing touch is your interaction with people, with patients. And I think many people forget, especially maybe intelligent ones, how important that could be. So I think about different types of doctors. There's this one attending, BW, that everybody who knows him would say his name, or WW, I guess. But people remember him as a very smart guy, but very arrogant and cocky, and would presume he doesn't have good interaction with the patients. I mean, not that they love him or anything like that. But he's good, he figures things out. And then you have the stupid doctors. I know a lot of these, they're like dumb as a rock. They're very cheery, happy, they go and talk to patients, and they do everything wrong. Do they make patients feel better? Or does BW make patients feel better? Because I would say, as somebody who has some intelligence, I would find it hard to accept that these stupid doctors who are just happy, cheery, and actually have no idea what's going on make patients feel better. But I think they may. So this past week I had a lady who I spent a long time talking to. And you need to go through a translator, which always makes it more painful for us. Because it's not just the double amount of time, right? It's also the fact that there's a cultural difference. So when I talked to her the first day, it was like an hour. And the next day, I was like, oh, I need to try to get out early, blah, blah, blah. But it ended up being another 45 minutes. But, we talk a lot. And I was wanting to get out early, but I just said, okay, this is what I signed up to. I'm a doctor. I'm going to stay here and spend time with her. And I realized she felt better just because I talked to her. She's there because she has issues with eating, belly issues. The GI doctor has done an extensive investigation. They've tried so many medications, and nothing's worked. And yet here I'm not sitting, I'm standing actually. In these double rooms, there's often no extra seats. But anyways, here I'm standing, talking to her, via a translator. Her mostly looking at a translator, not looking at me. And she's feeling better. Objectively, I know I made her feel good because she said, basically, she's never met a doctor like me. No other doctors get her, try the medications, but somehow I convinced her. But the thing I find that's very interesting is how you do it, right? And so I did a lot of things that I don't know that I don't do normally, but she pointed out. And so I'll mention it here today in case maybe this is not common practice and something that other people can learn. So one is I share examples from my personal life, people I know, versus things I've gone through myself. I use analogies. Try to explain stuff in a way that somebody who's non-medical understands. So to give more concrete examples, I say things about life, right? So she has a hard time in life. An unhappy marriage, a child with developmental issues. And I feel like, for me personally, many times there's an elephant in the room, you just put it out there, you just state it, right? I said, look, we can't change our circumstances. I mean, I would love to give you a loving husband and a son who is in school and on his vacations taking his mom to a trip to Europe. But you and I both know that's not going to happen. You know because you've tried. I mean, she's been married for a long time, right? Just stating things, right? Sort of bluntly. These are your issues in the background, at home, that nobody knew about, right? I mean, I had an inkling already because I asked the other doctor, hey, have you talked to her family? She's like, oh, no. She said she could communicate with her husband. She doesn't want me to call. That's strange, right? Most people would say, oh, yeah, don't bother them. But they would actually say, it's okay. I could communicate. You don't call them, right? They would say, oh, yeah, you can call them if you like, but it's okay. But they don't say, don't call them. So, using analogies, many times we use medical terms, right? Many times we use medical concepts. And we forget that patients don't understand all these things because they're not medical professionals. So I think we have to use other analogies, other ways of describing it that somebody could understand. Just like if you're reading a book about something that you don't understand, say engineering, you think them using engineering terms, like say while we're talking about how transistors work, right? Because there's no such thing as a perfect 0 or 1. There's always that transition for the cutoff when you have the voltage jumping. And sometimes you use a 0.7 as a cutoff. You have no idea what I'm talking about, right? Maybe analogy would be helpful. And so I think that's one thing that doctors are not good at, using analogies. An analogy may actually be an example from your own life of when you did this and this happened, right? Like the way I describe to her that psychiatry might be helpful is I start with example from my own life. My in-laws, right? They have some medical issues. They go see the doctor. And many times they get prescribed a psychiatric medicine and actually helps them and feel better. But they stop taking after a while because they don't want to be addicted. And she laughs. But she understands, right? And I say, look, the thing is, you're just very sensitive to what's going on inside your body. I'm just not as sensitive, right? And many times in our modern medical technology, we just can't figure things out. Doesn't mean there's nothing wrong. Like for me, I have a lot of bowel movements every day, more than anybody would say is normal. But they've done extensive work on me. They say, you're fine. And I want to believe that I'm fine, as in I don't have cancer, but I'm not actually fine. This is not normal. But I just have to accept it in life and get used to it. For you can't accept it. That's the thing. You can't eat with all your abdominal symptoms. So you're overly sensitive to feeling these things. People feel palpitations. That's always abnormal. You should never feel your heart beating because it beats all the time. You could be driven crazy. But if you're overly sensitive, it's obviously processed in our brain. If we have a way of making it less sensitive, would that be helpful? See, you don't present it as you're crazy. You just say that, you're more sensitive, which is not a bad thing, right? I mean, think about it this way. Going on roller coasters, getting seasick, all those things bad, right? Except that actually it means your middle ear functions better than most other people's, which isn't that a good thing? You have a better sense of balance. But somehow it's bad now for our world, right? So the whole point is when we interact with patients, and to my friend who's a surgeon, I'm sorry, but I guess you probably just don't have these experiences because you don't have as much time. But at least for me as a doctor who does have more time, I'm just an internal medicine doctor, there is this healing touch. And especially GI symptoms and all those things. You could make them feel better and get better without even any medications, just by talking, understanding, listening to them. And I feel truly for this patient, if I could find somebody who will listen and understand her and have a conversation with her just for like a half an hour each and every day, she will improve more than all that modern medicine has to offer. And they already offered it. And she's obviously not improved because she's here in the hospital, sick again. But the healing touch is still there. What I mean by it still works is just not commonly practiced anymore, unfortunately.